My name is Metcalf and I'm a specialist podiatrist working for County Health Partnerships, part of Nottinghamshire Healthcare Trust. For the last couple of years, me and a few of my colleagues have been talking about the fact that we were aware that a lot of the patients that underwent dialysis were at really high risk of developing complications with their feet, especially the diabetic patients. We found that a lot of patients were struggling to attend our community clinics and access the service.
I'd go into park house in my car, couldn't find a parking space, and it used to be a nuisance. And you find a parking space and then I got to walk from one place to another, but I found it difficult. It was too much.
Earlier this year I applied to go on to the Investor Lead programme, which consisted of quite a few different elements, teaching us how to look at problem solving and how we present ourselves, and a lot of other things to do with leadership, which was really interesting to learn about from the perspective of a fairly junior Band 6 clinical member of staff. So it was a fantastic opportunity to get to meet some of the more senior people in the organisation. And part of the Investor Lead programme involved the Ingenuity project, which was the team coming from the university, who showed us a really interesting method of problem solving. And it sounds a bit dramatic, but it's really changed the way I think about problem solving. Just taking a step back and breaking things down and looking at all the different possible solutions. As part of that, we had to come up with an Ingenuity project to try and improve an element of care or service. And I thought this was a brilliant opportunity to look at the problem that we'd already identified and see if we could come up with a solution for it.
So we offered a service on the dialysis units to people that found it difficult to access our service because they were on dialysis 3 days a week and then would have to come on their day off.
We went on to all the units and we took the time to speak to absolutely every patient that was attending dialysis. We went on different days just to get an idea of whether this service would benefit them and if they'd be interested, which was really helpful and really helped us to know that what we were doing is something that would hopefully be of benefit to the patients.
I'm a specialist podiatrist, so I would go on to the units, assess them. They're all high risk if they're on dialysis, and then just basically prevent anything from happening. If they've got pressure areas, refer them to relevant people. If they've got problems with their footwear, refer them to the orthotist.
The response has been amazing from the patients. They've been really warm to it, and they've been telling us what a difference the service has made to them. We've had loads of comments about how their feet feel better, how they can walk better, how they're in less pain, how the advice that we've given them about footwear and caring for their feet, such as creaming's made a real difference.
It's really nice to hear that we're making a difference to their life, because they don't have to go out on their day off and they go out 3 mornings a week, and when it's freezing cold and icy and they're very poorly, it's just nice that if we can offer that service, then I think we should.
It's much better now to do 2 jobs in one. They'll attend to my feet, which I can't do. Cut and file the nails. Advise you on shoes. It's perfect really, because I can lay here on that and have my feet done. Whereas I used to go and try and get my feet done up there, and then I'd perhaps have to come to dialysis.
It's become clear as we've started the project that there is so many different elements to the care that these patients need, and that if we can work together better with different health professions, then we can make sure patients get the best care with the least stress to them, because it is very difficult for them to attend appointments. So if we can work together, it's fantastic.